اوكي interesting fact. واضحه الشاشه؟
لا مش طالع.
مش طالعه الشاشه. الشاشه طالعه هيك؟
دكتور هيك.
تمام دكتور.
طيب okay, interesting facts. FDA does not use the term OTC medication. The official term is OTC drug. The main difference between medication and drugs is that drugs are the active ingredient. Is the active ingredient of a medication. Medication is the active ingredient plus the inactive ingredient. This is the main difference between drugs and medications. Drugs, when we say atenolol per se is drug. بينما atenolol tablet بيكون فيها excipients بنسميها medication. Is that clear? الفرق بين the difference between drugs and medication. واضح؟
تمام دكتور، يس واضح.
طيب female individuals are more likely to use OTC medications. In 2002 survey, 87% of women reported the use of an OTC pain medication in the past year compared to 80% of men. So basically, the majority of women, they use OTC medication more than men. A study conducted in 2011 confirmed that OTC medication are Americans' most popular treatment choice for common ailments such as headache, heartburn, and allergy. أكتر شيء بيستخدموا أكتر. Do you know what's the most commonly used OTC medication؟ مين بيعرف؟ Panadol اللي هو paracetamol. Excellent. So basically, we have categories for using OTC. We have muscle joint back pain, headaches, allergy, sinus problems, skin problems, upset stomach, and nausea, constipation or diarrhea, and muscle joint and back pain occupies the first category or the highly used category of among all OTC medication. وأكثر دواء, the most commonly used OTC medication is paracetamol أو acetaminophen. Acetaminophen American name. Paracetamol European name. يعني في أمريكا ما في عندنا شيء اسمه paracetamol. في عندنا شيء اسمه acetaminophen. And paracetamol and acetaminophen is the same. No difference. But in America, they call it acetaminophen. In Europe, they call it paracetamol. Poison Prevention Packaging Act of 1970 passed to prevent accidental childhood poisoning. So this law governed the use of medication to prevent childhood poisoning. اللي هو تسمم الأطفال. From prescription and non-prescription products, from prescription and non-prescription products. Enforced by the Consumer Product Safety Commission. هاي هي agency. This is the agency that enforce means يعني support. Requires most over-the-counter and legit drugs to be packaged in child-resistant container. يعني all medication should be packaged in child-resistant container. Why? To prevent the access of medication to children. Cannot be opened by 80% of children under 5, or can be opened by 90% of others. This is called child-resistant container, which means cannot be opened by 80% of children under 5. Older patient may request a non-child resistant container. Other exceptions are provided for by law. Evaluation of OTC drugs. How to evaluate an OTC drug? Over-the-counter drugs play an increasingly vital role in most healthcare systems. We see that we can prescribe OTC medication as a pharmacist. You can prescribe an OTC medication for patients without the need for a prescription. As with prescription drugs, FDA Center of Drug Evaluation and Research oversee OTC drugs to ensure that they are properly labeled. Very important to have an adequately labeled OTC medication, and that their benefit outweigh their risk. Yani we will not prescribe without a prescription for a medication that is dangerous. For example, digoxin مثلا. تعرفوا digoxin? Do you know digoxin?
دكتور قاعد
Digoxin is a cardiovascular medication. I think you took this medication in Pharma 1. Digoxin.
دكتور أخذنا.
It's a medication with narrow therapeutic index. It's a positive inotropic agent. The main side effect for digoxin is visual changes and bradycardia. We cannot prescribe digoxin as OTC because this is a dangerous medication. Okay? We prescribe medication OTC if they are safe to be prescribed as OTC. Characteristic of eligibility for OTC approval. Before the medication considered as OTC, it was prescription medication. Then it was changed to an OTC medication. OTC drugs generally have these characteristics. They have to meet all the characteristics to be eligible for OTC approval. So there is a process of approval for OTC medication. First of all, their benefits outweigh their risks, which means they are beneficial and they don't have risk. They are not narrow therapeutic index. They don't have side effects. They don't have drug-drug interactions. The potential for misuse and abuse is low. And we said the difference between abuse and misuse. Misuse is the wrong use of medication, which could be intentional or unintentional. Intentional يعني مين عمدا أو unintentional مش عمدا. For not seeking any psychotropic or euphoric effect. Abuse is the intentional wrong use of medication for the purposes of euphoric or psychotropic effect. So we have misuse and abuse. There is a difference between misuse and abuse. Misuse is the wrong use of medication. الاستعمال الخاطئ للدواء could be intentional or unintentional. تمام? And without seeking any psychotropic or euphoric effect. يعني ما بستخدمه عشان أسلطن وأشعر حالي طاير وهيك. Abuse is the wrong use of medication, which is intentional for seeking psychotropic or psychological effect. يعني زي الإدمان. Consumer can use them for self-diagnosed condition. يعني without the need of prescription. This is the main characteristics of OTC medications. Consumer, which means the patient, can use them for self-diagnosed condition like headache, sinusitis, heartburn, diarrhea, constipation. They can be adequately labeled, which means you can put a label on the OTC medication and they are accurately labeled. Health practitioners are not needed for the safe and effective use of the product. You don't need a doctor to prescribe the medication. You, as a pharmacist, can dispense and give the patient this medication. So these are the characteristics of OTC medication. First of all, they are beneficial with no risk. The potential for being misused or abused is low. يعني مثلا زي الكودايين مثلا. Do you know codeine? What is codeine? أخذته فارما 2؟
دكتور كودايين واحد من الناتشورال برودكت من الاوبيوم بابي.
أخذته فارما 2 ولا لا؟
أخذنا نعم.
أخذته في chapter الأوبيويد صح؟
نعم.
هو كأنه
منهم
للوقف أو ناركوتيك هيك شيء.
opioids. It belongs to opioids. codeine it belongs to opioid. بنتمي لعائلة الopioids. هلا الكودايين في عليه potential for being misused and abused. Therefore, it cannot be considered as OTC medication. تمام؟ النقطة الثالثة, consumer can use them for self-diagnosed condition. They are adequately labeled and you don't need a healthcare practitioner or a GP or a doctor to prescribe the medication for the safe and effective use of the product. We also have something called Orange Book. The FDA publishes a list of all approved drug called approved drug product with therapeutic equivalence evaluation, also known the Orange Book, because it's orange cover. Why we call it Orange Book? Because of its orange cover. It lists marketed drug products that are considered by the FDA to be safe and effective and provides information on the therapeutic equivalence evaluation for approved multi-source prescription drug products monthly. So basically this Orange Book is a monthly published book, okay, give you lists of all approved medication and marketing products موجودة عندي في الماركت. The Orange Book rates drugs based on their therapeutic equivalence. شو يعني therapeutic equivalence؟ يعني الفائدة تبعته المرجوة. Therapeutic equivalence. For a product to be considered therapeutically equivalent, it must be both pharmaceutically equivalent, which means the same dose, dosage form, strength, and bioequivalent. The rate and extent of absorption not significantly different than the rate and extent of absorption of drug with which it was interchanged. يعني مثلا عشان يكون الدواء ثيرابيكلي، يعني مثلا البدائل التجارية, the brand names of the medication. We have, for example, Panda, which is paracetamol, and Tylenol, which is paracetamol. Both of them, they are pharmaceutically equivalent. يعني بدائل الدواء, البراند names للدواء. هلا الactive ingredient is the same, but the brand name is different. We say that they are pharmaceutically equivalent if the dosage form and strength is the same. And we say they are bioequivalent if the extent of absorption and pharmacokinetics parameters, they are the same. Is that clear, واضح? Hello?
نعم واضح دكتور.
Any questions? في أي سؤال؟ طيب, what does FDA do with regard to OTC drugs? They review OTC product for safety and effectiveness, responsible for establishment of regulation for OTC drug labeling. So the FDA, which is the Food and Drug Administration, which is an American organization in America, they establish regulation, تعليمات, for OTC labeling. Also, they are responsible for reclassifying process, which means if you have a prescription medication, you can reclassify it to become an OTC. This is called reclassifying. Reclassifying process is the change from prescription medication to an OTC medication. And we have a lot of medication, they were prescription and they were changed to an OTC medication. Drug reclassification, classes of drug limited to prescription, certain habit-forming drug listed by name, drug not safe for use except under the supervision of licensed practitioner because of toxicity. For example, digoxin, lithium, warfarin, هذولا, we cannot prescribe them without a prescription because they have side effects, they are not safe. Drugs limited to prescription under an NDA, which is a new drug application, which is one of the stages that the drug pass through during the approval of medication. نسميها NDA اللي هو New Drug Application. لما يطلع الدواء مثلا يخترعوه بمر في processing بيجربوه على rats. They make experiments of the medication on rats. Then they do the toxicology research. Then they do research on human. Then they marketing. Then there is something called post-marketing surveillance. So the application for a medication or the duration of time or the time required so that the medication then can pass through stages for approval, it could last for 20 years, 15 to 20 years. يعني الدواء لما بيطلع ما بيطلع بيوم وليلة، باخذ وقت ليطلع للماركت وبكون مار في تجارب على الفئران، على الهيومن، على بيعملوا له توكسيكولوجي ريبورت، توكسيكولوجي ستاديز، بعدين بصير في بوست ماركتينج سيرفيلانس. يعني الدواء لما بيطلع بمر له اقل شيء من 10 ل 20 سنه وهو بيخضع للتجارب، ومكلف جدا الدواء، بس يطلع بكلف ملايين. يعني ما تفكروا ان الدواء بيطلع بالسهل. اوكي، drug reclassification. RX mean prescription medication. OTC mean without prescription, over the counter. OTC stands for over the counter. Reclassification criteria. The indications for which the drug to be used on an OTC basis should be similar to those on prescription. For example, ranitidine. Do you know ranitidine?
H2 blocker.
H2 blocker, yes. ranitidine عيار ال 300 كان prescription، وهلا صار ايش؟ without prescription. So which means if you want to reclassify a medication, the uses of the medication should be the same in the prescription and OTC status. This is the first item. The second item is a favorable adverse event and drug interaction profiles relatively low toxicity and low potential of abuse. The medication to be reclassified should have a safety profile, should have a low safety, a good safety profile without side effects, without interaction. The drug should not have properties that make it impractical for OTC use. For example, digoxin, narrow therapeutic index, lithium, digoxin, warfarin, for example, thiophelin. All these medications with narrow therapeutic index, digoxin, lithium, thiophelin, warfarin. Okay, so the medication, yeah, phenytoin. For example, phenytoin, which is an anticonvulsant agent. طبعا phenytoin, the main side effects of phenytoin, I think you took it in Pharma 2, أخذتوه Pharma 2, is gingival hyperplasia, and the daily dose of warfarin is 300 milligram, loading dose وبعدين بنعطيه 100 maintenance dose. So we cannot consider phenytoin as OTC medication. Why? Because it has narrow therapeutic index. And there is a difference between therapeutic index and therapeutic window. أخذتوها بفارما 1. You took the difference between therapeutic index and therapeutic window in Pharma 1. Do you know what the difference between therapeutic index and therapeutic window?
دكتور، الثيرابيوتيك اندكس هي قد ايه الكميه من هذا الميديكيشن اللي منها بناخذ جرعه علاج، وقد ايه الجرعه اللي بتصير توكسيك، صح؟
هي narrow therapeutic index, it's LD50, lethal dose 50 على over divided by ED50, effective dose 50. This is therapeutic index. Therapeutic window is the difference between the toxic dose and the effective dose. فرق يعني minus effective toxic dose minus effective dose. This is called therapeutic window. Therapeutic index is LD50 over ED50. واضح؟
تمام دكتور.
واضح شو بحكي؟ فاهمين علي شو بسولف؟
يس تمام دكتور.
كم الساعة صارت؟ طيب, the need for new labeling, switch from prescription to OTC, the need for more sophisticated self-diagnostic and self-monitoring evaluation. The older population is increasing in the United States. The new format help pharmacists to readily find information on label and point it to the patient. طبعا احنا in Jordan, we rely on the leaflet inside the medication box to know more information about the medication and to describe this medication to the patient. يعني احنا we have the leaflet. تعرفوا الليفلت اللي جوا علبة الدواء؟
دكتور.
تمام. From May 2002, most OTC medicines manufactured after this carry the new drug fact label. في كمان drug fact label هذا بنحط على ال OTC medication. However, certain products such as sunscreens were not required until 2006. Sunscreen اللي هي واقي الشمس. وهذا هو label. As you can see, we have many elements of this labels. First of all, we have active ingredient, which means اللي هو the therapeutic substance. And we have inactive ingredient. So the active ingredient, we call it a drug, while the whole packet of this, the whole package, we call it medicine. So active ingredient alone is called drug. Active ingredient plus inactive ingredient, we call it medication. Is that clear? واضح?
نعم.
طيب. We have something called uses, symptoms or diseases the product will, I think we describe, شرحناها هاي صح؟
دكتور شرحناها.
بنعيدها كمان مرة. بنعيدها كمان مرة مش مشكلة للناس اللي ما حضروا. Uses, symptoms or diseases the product will treat or prevent. This is the uses. We have warnings. Warnings, you cannot use the medication safely. يعني محاذير الاستعمال. When not to use the product, conditions that may require advice from a doctor before taking the product, possible interaction or side effects, when to stop taking the product and when to contact a doctor. If you are pregnant, breastfeeding, مرضعة يعني, seek guidance from a healthcare professional, keep product out of children's reach. So this is the warning section. As you can see here, we have glaucoma, breathing problems such as emphysema or chronic bronchitis, trouble urinating due to enlarged prostate gland. Yani we have warnings, the conditions that you cannot use the medication. Then we have purpose, the main aim of using the product, product action or category, for example, antihistamine. This medication here is called chlorpheniramine maleate, which is one of the antihistamines اللي راح ناخدها in details next lecture. Product action or category such as an antihistamine, antacid, or cough suppressants. Then we have something called directions, is how to use the medication, how much to take, when to take, how often, for how long. This is the direction of using the medication. And we have other information related to storage criteria. How to store a product properly and required information about certain ingredients such as the amount of calcium, potassium, sodium the product contains. Then we have inactive ingredients such as coloring agent, flavoring agent, binder. اللي هي أخذتوا سوتكس؟ فارماسوتكس اخذته اللي هي الاناكتيف انجريدينت زي البايندر والكالرنج ايجنت والفليفرنج ايجنت وهكذا. Checklist for choosing over-the-counter medicine. Active ingredients. Make sure the active ingredients are not the same as those medicines already being used. Which means we need to avoid duplication of medication. Don't use two active ingredients together. يعني ما تستخدموا الدوايين اللي هم نفس الactive ingredient. If the medicine contains more than one active ingredient, read the purpose of each active ingredient to make sure that all the active ingredients are needed for the problems or symptoms to be treated. If we have combined active ingredient, you have to read the purpose for each active ingredient separately. Uses, find medicine that treat only problem symptoms to be treated. Uses, which is the indications. Warning, is there any reason this medicine should not be used? محاذير الاستعمال. Is there any reason to talk to a doctor or pharmacy before using this medicine? Direction, find the correct dose of the package. Make sure liquid medicines comes with a measuring tool like spoon بتكون موجودة أو measuring device to measure the dose. If not, ask one at the pharmacy. Spoons are made for eating and cooking, may give the wrong dose, should not be used. Don't use spoons at home. Then they have different measures and you can give different doses. So use the spoon inside the box of the medication, inside the medication box. If you don't have spoon inside the medication box, ask the pharmacist to give you spoon so you can give. Why? Because this is very sensitive in pediatric. In children, you can't give high dose for children because like spoons اللي هم المعالق اللي بنستخدمهم في الأكل cooking or cooking spoons, they don't have the same measure as pharmaceutical spoons, okay? So be careful. خصوصا في البيدياتريك. The drug fact label in the United States, each OTC medicine has a drug fact label. The drug fact label is there to help you choose the right OTC medicine and use it safely. All medicine, even OTC medicine, can cause side effects, which is unexpected or unwanted effect, but if the direction label are followed, the chance for side effect can be lowered. So you have to follow the direction on the drug fact label. So sections of the label, we have active ingredient and purposes. Like the previous example, we have active ingredient chlorpheniramine maleate. So this is the drug, the whole package called medicine. We have the uses, the warning, the purpose, the direction, other information on inactive ingredient. Warnings means when to talk to a doctor first, how the medicine might make person feel, when the medicine should not be used, things that should not be done while using the medicine, when to stop using the medicine, to check with a doctor before using medicine if the person is pregnant or breastfeeding, to keep medicine away from children. We have other section called the direction. The direction means how to use the medication, how much to use the dose, how to use it, the route of administration, how often, the frequency, and how long, the duration. Other information tells you how to keep the medicine when it's not being used, how to store the medication. In active ingredient section tells you the parts of the medicine that are not active ingredients. These parts are added to help shape the form, to flavor or color the medicine, or to help the medicine last longer, like preservatives. مواد الحافظة, preservatives. So preservatives is inactive ingredient. Check this section to see if there is anything that might cause allergic reaction. Some patients, they are allergic to the excipients or the inactive ingredients, so be careful. If you are allergic to something, for example, found in the medication, don't take the medication because you will end up with allergy, okay? This is how the label looks like. we have active ingredient, purpose, chlorpheniramine maleate, antihistamine, uses temporary relief. طبعا هذا الليبل هيك في امريكا بيكون موجود. احنا في الاردن جوردن it doesn't look like the same. Okay, because we have leaflet inside the box. Uses, we have sneezing, runny nose, itchy watery eyes, itchy throat. Warning, glaucoma. كيف يعني glaucoma؟
تفاضل العين.
طب اعطوني 5 ادويه بنعالج فيها الجلوكوما، اخذتوها بفارما 1. يلا.
اتروبين.
اتروبين بنعطيه للجلوكوما. Are you sure? Give me 5
لا
medications, 5 classes. We use it for the treatment of glaucoma.
muscarinic agonist.
Muscarinic agonist like what? Pilocarpine, right?
بيلوكاربين. ممكن كمان دايوريتك
Diuretics, excellent. Carbonic anhydrase inhibitors like acetazolamide. Okay.
Yes.
Dorzolamide. Okay. ايش كمان؟ Epinephrine. Can we use epinephrine in pathomimetic?
Yes we can. راح يزيد الفلو.
ايش كمان؟
بيتا بلوكرز دكتور.
Beta blockers, excellent, like betaxolol, timolol. ايش كمان؟
أدوية الكولينوميميتيك دراج.
Cholinomimetic drug, cholinergic agonist. We say pilocarpine. This is number 1. Prostaglandin, excellent. Prostaglandin analogs like latanoprost, travoprost. So basically, for the treatment of glaucoma, we have 5 classes. We have, طبعا this is not in the exam, okay? This will not be included in the exam. But we do some revision, you know, for glaucoma. Glaucoma, we treat glaucoma by 5 classes. First of all, cholinergic agonist, like pilocarpine. Beta blocker, like betaxolol or timolol. We use epinephrine, sympathomimetic. We use diuretics, carbonic anhydrase inhibitors such as acetazolamide and dorzolamide. Then finally, we have prostaglandin analog like travoprost or latanoprost. هذا معلومات لكم انتم عشان في الفارماسي تعرفوا كيف تعالجوا الجلوكوما. اوكي؟ واضح؟ Is that clear؟
نعم.
طيب احنا خلصنا. Time is up. في حدا عنده any questions؟ Do you have any questions? Any questions? أي سؤال؟ Hello.
لا دكتور خلص الظاهر انه ما في سؤال.
طيب تمام. يلا يعطيكم العافية. احنا ماشيين كويس. الامتحانات راح تكون first second final، واول امتحان راح يكون ب3/4 يعني برمضان.
إن شاء الله.
تمام. الكل شابك معي. في حدا قطع عنده النت؟ رامي مناف ما شبك ليش؟
دكتور مو بس رامي، في أكثر من حدا ما قدروا أصلا كمان يعودوا يفوتوا حتى بعد ما فتحت المحاضرة الثانية.
جد؟ طب شو السبب؟ شو السبب؟ مش عارف. بجوز النت عندهم ضعيف. معقول؟ طيب اوكي. see you next Sunday ان شاء الله. واذا في سؤال اسالوني. في شيء مش واضح
لا دكتور كله واضح.
يلا يعطيكم العافيه.